We begin with the coronavirus. Hospitalizations across the metro are at their highest level since the pandemic began. Good afternoon, I'm Laura Moritz.
And I'm Kelly Eckerman. KMBC 9's Emily Hallwick is taking a closer look at those numbers and what they mean. And she's joining us live now from Truman Medical Center.
Now, the number of patients hospitalized with COVID-19 has gone up in recent weeks on both sides of the state line. There are still ICU beds available, but hospitals have a plan in place in case that changes. Truman Medical Center is one of many metro area hospitals seeing more COVID-19 patients.
People aren't necessarily following all of the recommendations of wearing their mask like they should.
Steve Hager is the hospital's director of emergency management and works with hospitals around the region through the Mid-America Regional Council. According to the council's regional COVID-19 dashboard, as of October 13th, the metro hit its highest number of new hospitalizations since the pandemic began, with a 7-day average of 133 new hospitalizations per day.
If we're not able to keep these numbers down, then businesses are going to look at having to close again, and no one wants to get back to that point.
For now, there is still room in ICUs. 10% of ICU beds in the metro are currently being used by COVID-19 patients, and 29%, or about 300 beds, are available.
Fortunately, we're seeing the acuity not being as high, so our ICU numbers and our ventilator patients aren't as high as what we've seen in the past.
Hager says if ICUs were to fill up, hospitals would postpone routine surgeries to open up more space.
And we would use those surgical areas, the pre-op, the post-op areas, and turn those into intensive care units.
He's urging people to continue to take precautions before that happens. And there is another factor here that might be increasing hospitalizations. Hager said that anyone who comes into the hospital for any reason is tested for COVID-19. So if they're admitted for something else, but they have COVID-19, that is counted in those COVID-19 hospitalizations. Reporting live in Kansas City, Emily Hallwick, KMBC 9 News.
If you want to see that data for yourself, we do have a link to Mark's regional COVID-19 database and other resources. It's all at kmbc.com.
Kansas health officials say the coronavirus has spread to every single county in the state. During today's briefing from the University of Kansas Health System, a doctor says that in some rural areas, sheriff's offices and fire departments have had to close due to people being quarantined.
We're also seeing it move to those rural counties that thought they were not susceptible to the virus. And in fact, they can be hit harder because they have smaller workforces. And when you have people out with illness or quarantine, it really affects the workforce.
Here are the COVID numbers at the University of Kansas Health System. There are 26 patients. 7 are in the intensive care unit. 6 of them are on a ventilator. Kansas is reporting 1,200 new cases of coronavirus since Monday. Missouri is still working to update its COVID-19 dashboard. This is the 7-day moving average of percent positive tests. It's one of the best ways to gauge the current situation with COVID-19. In Kansas, as you see, 17% of tests are coming back positive. In Missouri, it's 7.5%. The national rate is 5%. A high positivity rate like what we see there in Kansas may indicate insufficient testing.